thank you for the kind introduction. So my name is Maurice Michel, and I'm a resident at the University Medical Center in Mainz. And I'm very grateful to present our data here on a study that we've conducted in the Rhine-Main area, so kind of next door. And it's about the prevalence of liver fibrosis and cirrhosis in the German disease management program for type 2 diabetes. Well, no conflicts of interest. And just a little background, type 2 diabetes. Well, we all know the prevalence is increasing and it's associated with an organ injury, mainly microvascular and macrovascular complications. And here's an image showing the complications that we're all familiar with, that we all know. And so in Germany, we have this program, it's called a disease management program, and it's specifically for patients with type 2 diabetes, and it's to screen for related comorbidities. So, and here here you can see what is included in the disease management program, and it's checking for the kidneys, it's looking for the eyes for retinopathy, it's also checking blood pressure to check for cardiovascular disease and feed inspection, and also HbA1c. And so that is included, and that is also covered by the insurance in Germany. And so, but who's in charge of the DMP? It's mostly primary care providers who see these patients and on a regular basis. And so, but what about type 2 diabetes and fatty liver disease? Well, we all know this. It's a risk factor for disease progression, and so far, it has not been considered in the routine screening of these patients, especially within this disease management program in Germany. And so therefore, the aim of the study was to assess the prevalence of liver disease and its associated clinical risk factors in primary care centers participating in this diabetes program in Germany. And the methods that we used, so it was a total of 178 participants with a diagnosis of type 2 diabetes at primary care outpatient centers within this program. And well, we used transient elastography, and we've heard it earlier, it was the mini exam that we used, and we brought it to the primary care physicians. And we've assessed steatosis, fibrosis, and also cirrhosis, and these are the cutoffs that we used based on the literature and recommendations and guidelines. We've also assessed alcohol consumption with the audit questionnaire, and a score above 8 was considered a harmful alcohol consumption. And then, well, at the end, we've used statistics to identify clinical predictors of fibrosis and cirrhosis. And well, exclusion criteria were no type 2 diabetes, also a diagnosis of liver cirrhosis at baseline already, and well, we had 3 invalid scans with transient elastography. And so coming to the results, so the baseline characteristics, so that is the cohort. The median age was 66 years. The majority was male. We had 14 patients that had harmful alcohol consumption according to the audit. And well, the median LSM value was 7.2. And there was a high-risk profile for metabolic comorbidities, but also looking at the type 2 diabetes comorbidities, of course, cardiovascular disease was present, also chronic kidney disease. And so, well, we've then tried to assess the prevalence of liver disease in this cohort. And then we see that steatosis was present in 77%, and fibrosis in 42%, and cirrhosis, well, according to transient elastography, was present in 12% of this cohort. And then excluding those patients with harmful alcohol consumption, NAFLD was present in almost 70% of the patients. A comparison of the subgroups, well, there's a lot of data here, so I'm just going to highlight some of the main aspects. So the audit was positive, especially in those that were showing signs of cirrhosis, and the median LSM value was, well, obviously much higher in the cirrhosis subgroup. And looking at metabolic comorbidities, BMI was elevated in the fibrosis and cirrhosis group. And well, HbA1c was elevated, but not above a high threshold. And comorbidities were also present and mostly in the cirrhosis group. And well, insulin use was more often in the cirrhosis group. And so looking at the multivariable analyses, so looking at fibrosis, a predictor with a high odds ratio of 4.8, and also arterial hypertension were predictive of fibrosis, and also GGT as a lab value. But then also in a second model, with including the metabolic syndrome, it showed an odds ratio of 5. Cirrhosis was a similar pattern, also obesity associated with a higher odds ratio, and also the metabolic syndrome. And so these models were adjusted for sex, age, and also alcohol consumption according to the audit score. So we've looked at the obese subpopulation, and then if we see patients with fibrosis, 81% were obese, and in the cirrhosis subgroup, 85% were obese. And here's a comparison of the subgroups. Again, I'm not going to go over all the data, but looking at especially at the liver stiffness measurement by transient elastography in the obese subpopulation, the median value was 11.3. And so what were the limitations of the study? Of course, well, it was a cross-sectional design, and we had no analysis of outcomes, no outcomes in terms of HCC. It was only done by transient elastography, so of course under or over-reporting may have occurred. And well, we had lack of other non-invasive tests, especially the FIB4. And of course, well, the study was conducted in mice, and the cross-sectional design limits its to generalize it to other areas. So conclusion, well, we've seen a high prevalence of fatty liver disease in this cohort. And of course, if people have type 2 diabetes and obesity, they're an increased risk to develop fibrosis and cirrhosis. And well, these findings highlight the importance to also screen for liver disease within this program. And so that was also the main message of this study, to increase awareness also among the primary care providers. And well, of course, at the end, cost effectiveness needs to be analyzed, how transient elastography fits into this program. And so, yeah, thanks to all the co-authors of this study, and thank you for your attention.